and the acknowledgement. And we just want to thank you so much. So we are a global, diverse family fighting COVID. And tonight we have a special guest, and it gives me great pleasure to introduce Dr. Simbo Ige. She is the Assistant Commissioner for the Bureau of Health Equity Capacity Building at the New York City Department of Health. In this role, she works to build partnerships with community partners and other institutions to address health inequities across New York City. She also serves as the branch chief for COVID-19 community engagement for the agency's COVID-19 resurgence and vaccination program. Through the vaccination community engagement work, she works with community leaders to identify strategies to improve processes and systems to achieve vaccine equity in New York City. And as we celebrate Women's History Month, this is the last Monday of that month, please know that Dr. Ige is a woman of excellence and a source of pride for our community. So let's receive her tonight. Welcome, Dr. Ige. You're muted.
Thank you so much for this warm welcome. And I just want to take a moment to celebrate every woman in the room. This is Women Her Story Month. It is amazing to be a woman. We are enough. We are loved. We are beautiful. And we are amazing, awesome women in the room. So I want to say thank you to you all. And also thank you to Relum for being a steady partner in our fight for health equity. So thank you for having me, everyone. I look forward to answering your questions. Please don't be shy. If there are questions you've heard from others that you want to share, please also let's talk this out. Let's brainstorm and let's catch up on all things COVID.
Okay, so wonderful, guys. So let's start off the discussion with the news. Okay, so in the news, everyone is hearing, although the news is focused on Ukraine, which rightfully it should, but okay, we cannot forget that we are in the midst of a pandemic, and there is a variant called BA2 that is, just there, slowly raising its head. And we haven't spoken much. Well, on this platform, we spoke about it for the last couple of weeks, but it hasn't been so much the headliner in the news. So, so let's talk about a little bit about BA2 variant, what it is, what it means for us, how should we be prepared, what are some of the things that we should do? So let's start off there.
So let me start by just saying a little about variants generally, that viruses have the tendency to change their shape or mutate over time as they transmit from person to person. So we've had different kinds of variants over time. Some make the news, some don't. Alpha variant, Delta variant. When these variants, they become a concern when three things happen. One, if they're more infectious. Two, if they are likely to cause more severe disease. And three, if they are able to evade the protection from the vaccine or to reinfect those who have been infected before. When these three things are present, then we say this is a variant of concern. So in December, we had Omicron, which met all of these three criteria and became a rapidly spreading variant in our city. Over time, BA2 emerged, and BA2 is a sub-lineage of Omicron. So it is related to Omicron, but it has a few different characteristics from Omicron. And so it is part of that BA family. And it also has the same characteristics. It is more infectious. It can lead to severe disease. And it also has been shown to be able to evade the protection by the vaccine. So as at this moment, BA2 is responsible for the majority of the infections happening in New York. It's more than 50% of the infections. What that means is if someone has COVID right now, that person has a high likelihood that that COVID infection is caused by BA2. So it is circulating in our city. We are keeping a close eye on it. Cases are increasing a little, but not as dramatic as it was with Omicron. We're keeping a close eye on situation and hoping that it will not be as devastating as Omicron was during the December surge. Right now, we have a higher level of vaccination coverage in New York City than we've had before. Over 90% of New York City adults are vaccinated. We still have quite a bit of children who are not vaccinated, so there's still work to be done. Now, what can we do to be prepared for another surge? The first thing to note is if you're not vaccinated, please do so. Vaccines reduce the likelihood of severe illness and mortality. Number two is get a booster if it is more than 5 months since you got your second shot of your vaccine. So if you got vaccinated with Pfizer or Moderna and your second dose was more than 5 months ago, please go get a booster. This booster offers an additional layer of protection against this new variant. And then if you have an immunocompromised status, that is, if you're older than 65, or you have underlying medical conditions, or you are on medication that reduces your ability to mount up a defense against infection. If you fall into this category, the government is now recommending a fourth dose of the vaccine. That means if you have received a booster and it's been more than 5 months after that booster, then you can take another booster as we see the BA2 rising. So that's where we are.
Okay, I just want to acknowledge Councilmember Brooks in the House. Thank you for being with us tonight. So other questions? Does anybody have a question about this BA2 variant and what was just said and about how it can evade the immune system and how it can evade the current vaccines? Please, yeah, go ahead, Steve.
Yeah, I know, Dr. Simbu, nice meeting you. I know New York City in general has a high vaccination rate, but there are pockets of New York that I would not want to go and have dinner. And I don't want to call them out, but East New York is one of them, Starrett City, and I live in East Flatbush. So when you look at the overall, I would be more comfortable taking off my mask going to Park Slope, where it's 90%, 97% vaccinated. How are we working? I know vaccination hesitancy is a big deal in some community. Historically, Dr. Cronin and I worked together on HIV for a long time, so we know. But how are we going to be able to work with these communities to educate them? Because while other population of people are high in vaccination rate, these are the pockets that can drive the epidemic, the pandemic.
Right. Thank you very much for that, Steve. And you're right. We've been doing a lot of work to help make sure that our communities have all the information they need to be able to make a decision about the vaccine. Now, everyone's why is different. The reason why people are hesitant is different. What we have seen, though, is over time, we have seen more people accept the vaccine, either willingly or through the mandates. So right now in New York, across board, anyone 18 and older, 18 to 64, across board, we have vaccination over 70%. Now, the exception is Black adults. Those who are African American in New York City, we're still around 65% of residents are vaccinated. But for Latino New Yorkers, Asian, Native American, etc., vaccination rates are in 80s, 90% coverage, as high as 100% in those who are Asians. So the mandates helped a little. The workplace requirement has helped a lot. But we continue to provide opportunities like this for community members to ask questions. What we have noticed is within the Black community, within the African American community, the reason for the hesitancy is around trust. There is a long history of experimentation in the Black community. There's a long history of discrimination and people not being provided real factual information about health issues. And that has led to a lot of distrust and mistrust in the community, where people don't trust the government and people don't trust the pharmaceutical companies and people don't trust the healthcare system. So the way we have been addressing that is working with our partners like Relume and community members and faith leaders to provide opportunities for education. And also to highlight the stories of those who are vaccinated and are doing well. It's one thing for me to come and say, oh, I'm a doctor from the Department of Health, the vaccine is safe. It's another thing when your neighbor or your friend or your family member says, I am vaccinated and I'm okay. So providing opportunities for people to share their vaccination experience and stories, so people are not just frozen or terrified into inaction because of all of the negative things that they're hearing on social media. When you know actual real people who have been vaccinated and are doing well, people feel safer. So that's how we are hoping to encourage folks, to accept the vaccine, looking around them and seeing that millions of New Yorkers have already been vaccinated and are doing well.
Okay, other questions, guys? Questions about mask wearing? I know that those of you at the subway station have some experiences. Do you want to share anything? Sabrina, Walter? I thought I saw Sabrina in here.
Good evening, everyone. Hello.
Good evening. Hello.
Yes. Far as the mask concern, speaking on Dr. Crummy, they like the ones that we're giving out, the K95 ones, the K95. We don't have a problem with them not wearing it. Thank God they really wants to wear them. It kind of surprised me because I'm thinking like after they uplift the banner of the mask that we would have had a difficult time, but no, we really having a more successful time, believe it or not, so we're looking forward to keep on continuing on because they're looking forward to see us coming. And when we're not there, they have a problem. They want to know what's going on. So it has been very successful with the KN94s and the 95. And we're still looking forward, like I said, to continue on to give it to the community and everything. Train station is a big one. We have a lot of customers that ask us, residents, and ask us all type of questions about the vaccines, and pretty much some understand and some don't. Like they said, it's a big issue with the trust. Okay. It's slowly and surely coming along because some of them is starting to get vaccinated now. They do come back and ask us questions, and when they ask us certain, we are telling them to consult with their doctors if they have any type of underlying conditions or anything like that. So we're getting more successful in that area, thank God. It was a long drawing. I know my partner Walter can say it as well, but it's coming along. And we're just looking forward that we get that 100 or like they say, at least give me that 99.9, you know? So, yeah, we pretty much in a good place so far. So good.
Okay, what about access to the vaccines? Are you able to find the vaccine vans and the sites? We're in 11691, which is Far Rockaway.
Right.
Any problems with Sabrina with the vans?
Yes, we do have a lot of communities, people that actually don't even live in Far Rockaway that come off the train, ask us like, you know, what happened to the vans, what's the location, and pretty much, you know, we get it from you, Dr. Crony, or we'll call, or sometimes someone will inform us, like if it's one in the area. But a lot of times what happened is that they have them listed, but then when the people go there, they're not available for them. And then sometimes they don't stay on that site but a certain time frame. But you know, it'd be a minute before we can really say is one in that area now, because they move around. And I did ask a couple of them, you know, how does that go? And they said pretty much we don't leave completely out the zip code, but we do have times where we have to shift and go different places, which I understand that. But we do need a better connection when they are, you know, going in different areas, because a lot of our residents constantly ask us over and over. So that just letting me know they want the shots, you know, the vaccine. They want their booster. So that's a good thing on our behalf. It's just that we need to know, excuse me, the locations and how long they're gonna stay in that area, because sometimes they come and tell us, oh no, it's not there no more. You know, so that's the little, you know, clinch we have, to keep up where they're located, how long they're going to stay in the area. And when they do decide to move on, we need to know a better update with the vans and, you know, the hubs and stuff like that.
Well, if I may add to that, Dr. Crony, working backwards, I had a couple of things I wanted to say. Regarding the vaccine sites like that, I tried to just give them the number or a website and let them search themselves, because like Sabrina was saying, like when we get information from you, it usually comes time specific.
Right.
You know, and so you know, it's hard to do that. But by taking the flyers that we give them and simply writing on them, sometimes, you know, gets us out of that. But I also wanted to say that the information that we get on this platform is absolutely invaluable, because it enables me to answer their questions intelligently.
Right.
The biggest thing for me is this group who do their own research. It's a little frustrating. It's a little frustrating for me when I talk to them sometimes, because you have to be really very tactful and careful about the way you answer them, so that you're not, you know, insulting these endeavors. You know, that could just blow the whole show right there. So if you have any suggestions along those lines, I'd like to hear them.
Right. Thank you so much. I want to acknowledge some of the challenges that you have raised with regards to the mobile vaccination van. They were intended to be short-term complementary services to brick and mortar location. So like you observed, they don't stay for a long time. They go around the city from place to place. So usually they are in 11691 for maybe a week at a time, sometimes 2 weeks, and then they move on to another zip code based on the demand. So that's the reason why they move around. But I will recommend that the easiest way to help people is to give them the VAX number, the hotline, 877-VAX-NYC. If they call that number and give their zip code or their address, they will be linked to the nearest vaccination location. In 11691, for example, we also have partnership with St. John's Episcopal and other, community health centers that provide vaccination, so that we're not completely dependent on just the mobile vaccination option, so that people know that there are other options in case the vaccination is not available. For example, the partnership with St. John's, they are able to provide vaccination even later in the evening to help accommodate for those who are maybe at work during the day, and to have extended hours of service. So those are options that we can provide. But for those who don't have internet or cannot go online searching, just the number 877-VAX or NYC is a good number to remember. And in the call, they'll help you schedule up an appointment or point you to the right location for vaccination.
Well, that actually has worked better than anything else, because I had one woman come back to me and thank me because she had gotten her whole family vaccinated by way of using that number, which was very gratifying for me.
Okay, wonderful. I want to acknowledge Sharon. You have a question?
Yes. Hi, good evening. I was listening to the news this evening and they were talking about patients being diagnosed with the COVID-19, but when they're diagnosed, they're not checking for the BA2.
Right.
So how do you track BA2 if you're not checking? That's question one. And two, are the symptoms for BA2 the same as COVID-19?
Right. Thank you very much. Those are very good questions. So BA2, you cannot detect, you cannot tell what variant of COVID vaccine you are infected with the regular test. So that test is done through the public health laboratory at the Department of Health. So what happens is a sample of the COVID tests that are done in the city is sent to the public health laboratory. And then additional tests are done to determine what percentage of the tests that were done was due to what type of variant. So you cannot tell from the regular test what type of variant it is. And yes, the symptoms are similar. COVID is a respiratory virus, so there is likely to be fever, cough, sore throat. Some people have abdominal symptoms, some people feel nausea and vomiting, so those things can happen. Some people even have diarrhea. Then the symptom to watch out for is difficulty breathing. If the individual becomes breathless or is having a challenge, that is a sign to go to the hospital and get that checked out. So those are some of the common symptoms. Then there's the fatigue and body aches and bone pains that happen as well. So if you have any of those symptoms, don't assume that it is the flu. Don't think it is seasonal allergy. Don't think, oh, I'm just tired. These days, there are test kits available. You can get them from a public library. You can get them from our partners like Relum. And so better to get tested and you know what the symptoms are and then take appropriate next steps.
Okay, thank you.
Okay, wonderful. Any other questions? I know we usually have a lot of questions.
Yes. Can I just
Yes, go ahead, Sister Blackman. Go ahead.
All right. Listening to the doctor just now, what she said, and I had told you all about my sister, and I think that is exactly what happened. They tested her for maybe the first variants, and the test couldn't discover this last variant because her doctor said that she has another variant that they don't know. So I think that answers what happened to my sister, that those tests that she couldn't discover or recognize that variant. So I'm thanking you for that information. I'll pass it on to her, but she's okay. She's much better now, but she had all those symptoms, the coughing, the diarrhea, the everything she had. And these tests, both tests say no. But when she went to her doctor said, maybe it's a different variant. So that, you just answered that for me. Thank you.
Okay,
glad.
thank you. Yes, Michelle, do you have your hand raised? Go ahead.
Yes, good evening, everyone. Thank you for inviting me. As a nutritionist, I know earlier with the COVID, one of the things that was mentioned that there was a loss, in addition to the coughing, the respiratory problem, the sense of smell and the taste. And as I know, if you are sick, you lose your appetite. But then again, if with the BA2, will that also, I know it invades the immune system, would it also affect your taste and smell? Are we still concentrating in that aspect?
Yes, the BA2 can still affect your taste and smell, but it is no longer a symptom that happens all the time. So with Omicron, it is possible to have it or not have it. So not in the earlier versions, like the alpha variants, almost everyone who had COVID had that particular symptom. But with Omicron, some people do, some people don't. So that it may happen, but it may also not happen.
Okay, other questions, guys? I know you had questions about the $100. I remember hearing something like that last week. Any questions?
Sabrina has a hand up.
Who has? Go ahead.
Sabrina and Aris.
Yes. I would like
Okay.
to know with the variants that's out and those that did not take the vaccine. Okay, because if they didn't take the vaccine and you have people that took the vaccine, it's still a living germ. In other words, it's still gonna, is infected. So how do they expect for this to at least go down? And then they're giving us home test kits, right? Which is a good thing. But how do we account for how many people was affected? We can't account for it no more because of the home. Do they read where, do it comes in a department where it shows how many was affected? Because to me, it seemed like we will never know how many is really affected if they doing home testing. How do we,
That's right. So with the availability of home test kits, it is no longer possible to track every single test that was done and if that test is positive or not. What we track right now are the laboratory tests. For many people who test positive with the test kit, some of them go and get a confirmatory test in the laboratory. And that is what we track. So right now we don't have information on every single test that's available in New York. But what we use as a measure is the laboratory tests that come, and we use that to determine how high it is. There's also a measure that we use that's called percent positivity. That also helps us to see how much COVID is circulating in the city. For instance, if we do 100 tests, if let's say a laboratory does 100 tests, how many of those tests come back positive? When there is not a lot of COVID, the percent positivity is low. When there is a lot of COVID circulating, many of those tests come back positive. For instance, during Omicron, we went as high as 30% of the tests came back positive, almost as high as 40%. Now we only have 1-2% of the tests come back positive. So we also use that as a way to see how widespread COVID is in the city. So without actually knowing every single case, we can use that as a measure to see how bad the situation is.
I have a question regarding mutation.
Wait, can you hold that question, Walter? Yvette
Sure.
has her hand up for a while. Go ahead, Yvette.
Good evening, everybody.
Dr. Crony, you mentioned the $100. My grandson never got his $100 for his first vaccination. He received it at school. I filled out the form. It was supposed to come in the card, and I never received the card. He's also gotten his second shot. My question also in regards to that is, are they allowing the children to be boosted as well? And if so, how long after they get their second shot should they be boosted? My grandson is 8 years old, by the way, if that helps.
Yeah. And you said you never got your card?
No.
Oh, that's I'm sorry to hear that. I can put the link to the incentive page in the chat, so you can see if all the steps are followed and see what we can do. I think there's also a number that can be called.
Okay, thank you.
So with regards to the booster, it is the same protocol for everyone age 12 and older.
Okay.
If you get your first shot, then 3 weeks later, if you got Pfizer, you get your second shot. 4 weeks later, you get your second shot if it was Moderna. Then 5 months after your second shot, either Pfizer or Moderna, you can take your booster.
Even though he's 8 years old, because you said it's the same for 12 and up.
Yes.
So that's for everybody. Okay.
So because those who are age 5 and older only became eligible for the vaccine in November.
Right.
So many of them are not yet eligible for booster because it's not up to 5 months yet. But once it's 5 months after their secondary series, they can get a booster.
Okay. Thank you so much.
Okay, great. Walter, you had a question?
Yes. The virus itself, in whatever form it, alpha, delta, etc., does it require an unvaccinated host in order to mutate, or can it mutate in either vaccinated or unvaccinated host?
I don't have the information on whether the vaccination status determines. What we do know that mutations tend to occur when there is high transmission, and that is usually in unvaccinated populations. What happens is, as this virus goes from person to person, it adapts, and viruses do that all the time. We see, variants with the flu. That's why we need flu vaccines every year, because each year there's a new version of the virus. So it is not unusual for viruses to mutate or to change their shape. But this tends to happen in high transmission context. So that is why vaccination is so important, because with vaccination, the opportunity to transmit from person to person is lower. But as long as transmission continues, mutations are likely to emerge. And so high transmission drives mutations, which is why low vaccination encourages the development of mutations more than vaccination.
Okay, Rosie, you have your hand up. Please unmute.
Yeah, I just want to make sure that I understand that this is what I understand. I took notes. There might be, prepare for a resurgence. So when I meet people in my family, whatever, do I tell them to wear your mask? Oh, wait a minute. Wear your mask and social distancing, and also that this variant may not respond to the vaccine. Is that correct? That this variant may not be prevented by the vaccine. Is that correct?
Yes and no. This variant, if you are further along than 5 months after your vaccination, these variants can sneak by you and still infect you. That is why boosters are necessary. Think of it as a dog trying to burrow its way under a fence. If your fence is wobbly, it is more likely to succeed. If your fence is strong and reinforced with more bars, then it's less likely for the variant to be able to get past it. So the vaccine effectiveness drops from 90% to about 56% after 6 months. When you get a booster, it goes back up to 90%. So boosters are very important in keeping the variant at bay. So that's why we're promoting that. Now, the question is, should I wear a mask or not? In low transmission settings, you may take a break from wearing a mask when you're outdoors, because there is very few cases about. If you're indoors and you're in a company of people that you do not know their vaccination status, then we encourage you to keep your mask on. So if you're going into public transit, if you're going into a healthcare setting, if you're going into a school, or you're going into an indoor space where there will be people in there that you do not know their vaccination status, then please wear your mask, especially if you're older. Right now, the vaccination, the mask wearing requirements have been relaxed a little because we have low transmission. After 3 years of restrictions and, telling people to wear a mask, we feel there's value in giving people a little break now that we have low transmission. Now, that doesn't mean that we're over the pandemic, or it doesn't mean that if we begin to see cases rise again, that those requirements will not come back. But for now, because cases are lower, people can take a little break depending on their situation. Like in my department, 99% of those who work at Department of Health are vaccinated. If when we're indoors with our colleagues, we can take off our mask. But if we have to interact with the public, we put on our mask. So those are some of the context differences that will help guide people. But again, if you're not sure, better safe than sorry. So it is always a good idea to keep your mask on if you do not know the vaccination status of those who are in the room.
Yeah,
Okay. Okay, go ahead, Rosie.
I just want to say something very quickly. What I have noticed, which is surprising to me, is that when they relax the masks, I see more people with masks on now than I did before.
Right.
It might be something about when you tell somebody to do something, they don't want to do it. But when you leave it up to them. So I'm wondering if what I'm seeing is correct. I'm happy. I mean, people with masks, they're outside with masks on going, what? I hope that's really happening. That's what I'm hoping. Thank you so much for your information. God bless you.
Thank you. Thank you.
Okay, so we're going to, Sharon has her hand up, and that will be our concluding question for the evening. Go ahead, Sharon.
Another question concerning the fourth booster. Who's putting this one out, and can you mingle it with the others? You can?
Yes, so mixing and matching vaccines is okay. However, for Pfizer and Moderna, there is not any distinct advantage in doing so. For those who got Johnson & Johnson originally, it is recommended that they switch to Pfizer or Moderna. But if you already got Pfizer or Moderna, there is not any additional benefit to mix it up. But if you got Johnson & Johnson, you certainly should mix it up and get the Pfizer or Moderna vaccine for your booster.
Okay, thank you.
Okay, so I just want to thank everyone for coming on. I just want to again express our gratitude and our thanks to Dr. Ige for being here and just for answering all of our questions and our concerns. I hope that you've had a good opportunity to ask your questions. She's knowledgeable in the area, and so we took advantage of that knowledge tonight. So I want to thank her again and her team that's here with us tonight, for Clarissa and the others that are here with her tonight. So just thank you so much for joining us on this platform. Dr. Sunday, I'm going to turn it over to you. Go ahead.
Well, once again, I just want to use the opportunity to thank Dr. Ige for out of our very, very, very busy schedule, because I understand I mean, that is not easy, but for you to come around and to let the people on this platform know that you are actually the one who sent us to do what we do, that we're not doing it just of our own accord. But it's such a great thing to have people like you to come and talk to the community, our people, and for them to really understand, like you said, that the greatest example you can give is yourself. When you start telling people that I took it, nothing happened to me. So for also, I want to encourage everybody under the sound of my voice to go out there and influence your community for the positive, so that you can tell them that you took it, and you can even invite them to a platform like this where they can ask questions, and the ones we can answer, we can go back to Dr. Ige, and then she'll give us the necessary information. I'll be able to answer it. But I want to thank you and your crew for coming out to be a blessing to the people tonight. And thank you so much again. Once again, thank you.
Thank you so much. And I have to say, you're my brother, so anything for you.
Thank you.
Thank you very much.
Yes, ma'am.
And we just want to thank everyone that's here tonight. It's a pandemic, it's global. So whether you're in Nigeria, whether you're in the Caribbean, whether you're in the DMV or Boston or Philadelphia, whatever area you're from, it affects us all. We are all one family. So the information here is not wasted. Carry it with you wherever you are, and spread the news about getting vaccinated and wearing your mask and washing your hands and keeping your distance. And that's what we preach. We are here at Relume. We are here available to answer any of your questions. If we don't have the answer, we will certainly try to find the answer, but we're here to support our community. If you need test kits, if you need thermometers, if you need masks, okay, we're here to provide that for you. Whatever assistance you need, whatever navigation, healthcare issues you may need, we're here to point you in the right direction. So I want to thank everyone. I just see so many people on here. I even see Omega Sci-Fi on here, and I just see our local politicians and just everyone that has just been such a support to us, our community, our family. And so I don't want to keep you any longer. Have a great evening. Spread the news. We're here every Monday night. Any announcements?
I want to share a video.
Okay, go ahead.
Give me a minute.
Remember, share. I think I saw Nesta on here. Thank you, Steve. Thank you, Dr. Lamb. Thank you. Just everyone. I don't know everyone, but all of you, just thank you so much for coming and listening to the platform, and for sharing the information, just so that we can be a force in our community to help have our community be vaccinated, be safe, and receive all that we need in terms of equity. We're no less than anyone else, and we deserve the best, and we are here to provide the best. So thank you again. Sherry, you have the video? Okay, go ahead.
Stay blessed, stay safe, be safe.
Thank you, Steve.
Right.
Okay, I'm gonna
All right.
post. Hold on. Thank you again, Dr. Iana. Team, I'm gonna post the link for the YouTube video on the chat. Give me a minute in case you guys want to share that video, the link with people. Okay, so this is a link for today's presentation. So you can view it again or you can share it. Over to you, Dr. Kearney.
All right. So have a great night, everyone. And we look forward to seeing you again next week, God willing.
Thank you.
All right.
Thank you. God
Thank you.
bless.
Good night.
Thank you.